Hello, everyone. It's great to see you here today. I know I can't see you, but it's great to know that you're there. My name is Courtney Mall, Ask the Expert of 2024. I honestly cannot believe that we're wrapping this year up already. It was just back in February that I joined the Cure PSP team as the Associate Director of Education, and it's been an immense honor to partner with you all in learning more about these diseases and how we can manage them physically, emotionally, and socially. So honestly, a deep thank you to all of you for letting me be a part of your journeys. Today, though, we have an extremely tangible topic. We'll be talking about navigating employment, federal benefits, and mobility support. It's our hope that this conversation brings clarity and actionable items for you and your loved ones. The program will be 1 hour long with one question and answer session at the end. If you have any questions at any point during the presentation, please feel free to type them down into the chat. I'll do our best to address questions at the end that are relevant to the topic at hand, but just know that if they don't get answered today due to time constraints, or maybe you don't think it's quite relevant, please feel free to email us at info@curepsp.org. I feel like you have to scribble that down. The webinar will be recorded and emailed to all registrants and will also be posted on our YouTube page for future sharing and viewing. So lastly, I would love to know where you're tuning in from. I am in Brooklyn, New York myself. So feel free to put in the chat where you're tuning in from. We'd love to know. And I am going to introduce our speaker while you do so. So Sarah Mitchell-Chen, she is a licensed clinical social worker at Rush University Medical Center. She has more than 15 years of experience working as a clinician, program coordinator, and research team member. Sarah has spent her whole career providing care management and long-term care in ambulatory care settings, where she works to address non-medical barriers and medical barriers to wellness and improve healthcare outcomes for individuals and families impacted by these diseases and forms of dementia. As a result of her work with the Ames Care Clinic, Sarah has completed advanced training and certification in palliative care with an emphasis on helping people understand their choices and preferences for care. Sarah Crown Family School of Social Work, Policy and Practice with a special concentration in older adult studies. Thank you, Sarah, and the floor is all yours.
Thank you so much, Courtney, and thank you to Cure PSP for having me. As Courtney mentioned, I'm Sarah Mitchell-Chen, and I'm gonna do my best to give a high-level overview of some pretty complex topics today. So we will not be getting into all of the nitty-gritty. There's a lot that goes into each of these programs, but my hope is that we'll be able to give you some information and resources that will allow you to go and learn more and kind of get more information and have a sense of where to start and what to ask. So we'll start talking through kind of navigating employer-sponsored benefits, then federal benefits, and last but not least, kind of mobility supports and services. So navigating employment. If you are currently working and unfortunately end up being diagnosed with one of the atypicals, it's important to consider and familiarize yourself with your employer's human resource packages, which might include their policies and procedures. So one of the things you might want to better understand is the process potentially for requesting something like a Family Medical Leave Act. And that's a pretty standard thing. That's a federal policy. Family Medical Leave Act protects your job for 12 weeks. It doesn't necessarily guarantee payment for those 12 weeks, but it does hold your job. So something to keep in mind, let's say if you happened to have a hospitalization or needed to take a little bit of time off to do more intensive physical or occupational therapy, you might consider a leave like that. So helpful to know about how that works and what the policy is ahead of time. It also can be really helpful to determine if your employer offers benefits for short or long-term disability. And so a short-term disability would offer a certain percentage of your pay during potentially that 12 weeks of FMLA. These plans are specific to your employer, and so they can be a little bit different. I said 12 weeks but that's not standard for everybody. So you may find that you're entitled to 8. You might find out you're entitled to 16, but you won't know until you ask. And then also better understanding your long-term disability benefits. And one of the things to consider is what percentage of your pay is covered by those or paid through those programs. So some of them are 60, 50, it all matters, and having a better sense of what's included is important. And then you may want to consider as you're working, and if you're noticing that you're having a little more difficulty with certain tasks related or within your scope, you might think about meeting with a vocational rehab counselor and see if there are specific strategies that could be put in place. Or an occupational therapist even could do some of this for you too. So if there's specific things you're struggling with or noticing they're taking you longer, that's a resource to consider. And then you also might want to consider what are called reasonable accommodations. And so reasonable accommodations are a program that allows individuals to have allows adjustments to your job or work environment so that you're still able to perform the major requirements related to your job. And so reasonable accommodations are allowing both people to have equal or an even playing field as they're both applying for jobs and also once they're in the job that they're performing. And so if you're needing ideas or information about what is reasonable or what a reasonable accommodation might look like, the Job Accommodation Network is a fantastic resource. You can search their website both by diagnosis. And so while PSP or MSA aren't explicitly included on the website, Parkinson's disease is. And so you could start looking under Parkinson's disease. And then you can also look if there are specific other symptoms that you are having difficulty with. So if it's orthostatic hypotension, or you're having trouble with more mobility and walking or fine motor skills, there's all of that information is available under different categories on their website. And then you also can, if you're unsure or don't know where to start, you can also look under some of the specific scenarios. And so the request process for reasonable accommodations is going to depend a little bit on your employer. And so that's where better understanding what the process is through HR can be really helpful. But then you generally need some paperwork from your physician or provider to be completed. And then the HR reviews and determines if it's acceptable or reasonable in the status of this law. There's also a 1-800 number available through the Job Accommodation Network. So if you run into issues or have specific questions, you can also reach out to them as well. But they're a valuable resource for you. And then there may come a point over the course of your illness where you're no longer able to work. And you may kind of have a sense that this is coming. And it's never an easy decision. And it definitely can be fraught. So I say this, I always go into these conversations with a heavy heart because I know that it's not a fun conversation anyone wants to have. But I think when we think about leaving work, we really want you as the employee or the person living with MSA or PSP or CBS to be able to leave on your terms. We want you to have as much control over what the closure or the ending of that work, that period in your life looks like. And we also want you to be able to protect the benefits that you've worked so hard for. So the biggest takeaway at the very top of the screen is please don't quit. If you're able to, there are ways that you can leave work and protect some of the benefits that you're eligible for. So like I mentioned, you could go out on an FMLA leave and apply, take the 12 weeks. You would need paperwork completed by your physician, but then you could take that paperwork to your employer and they can initiate that leave for you. And I'll be honest, it's the beginning of a paperwork journey, but it may be what makes the most sense for you in conversation with your family and your physicians and just what is feasible for you and your body and your energy at this point. And then work with your healthcare team. Are there strategies of what you could be trying? Maybe it's a trial leave. You take some time off and you see, does reducing my stress and conserving some of my energy that otherwise would have been used towards getting myself out the door, how does that impact my symptoms? And if you're noticing that things really are improving and you want to try a trial back to work, fantastic. You tried going back to work at the end of that leave. If you're noticing that things really, yes, it's been helpful that your stress is reduced, but your symptoms really haven't improved that much, then you consider moving through that short-term leave and transitioning into a long-term leave. And so your physician can certainly help you with the paperwork, and it's certainly important to be having conversations with your care team so they better understand what your mind is, what's going on for you, so that they're in your corner and able to support you the best that they can. So keep in mind some things as you're considering moving through this process. Like I was saying, you really want to be communicating with your healthcare team. And honestly, you want to try to be communicating with your healthcare team even leading up to this process. So if you have spent the better part of your illness going into appointments and really trying to look your best and tell your providers that everything is fine, and they're documenting that everything is fine, that you're not noticing any complaints or issues where your symptoms are popping up, that's what's going to be documented in the medical record. And then when you file a request for a medical leave, the disability companies are going to ask for medical records. And if it's documented that everything has been fine up until the time that you made the request, it's going to be kind of hard to justify that there's been changes in your symptoms and your ability. So I would encourage you as much as possible to be as honest about your symptoms at your medical appointments, and thinking about kind of what bad days look like, not just the good days, thinking about how your symptoms impact day-to-day life. So, and trying to provide some practical examples of how you're seeing this showing up for you. You're wanting to create a paper trail, for lack of a better word. You want to demonstrate that, yes, I do have MSA and I'm doing the best that I can to fight MSA and to engage in treatment and care that's going to be best for me. But there are things that the MSA is impacting. And here is how it's showing up for me in these very practical instances. You might also consider getting the input from others around you, a spouse, adult children, friend, a coworker, to say, how do you notice that things have changed for me? If so, in what way? And kind of getting that outside perspective as well can be really helpful. And then one little caveat, and it's not so little, but a caveat to consider is unions. If you're a part of a union, those programs can run a little bit differently. They offer many similar programs, so they'll still offer a short and long-term disability policy or benefit, but it tends to be administered by the union board rather than, if you're a union member that works for a specific company. Your union would be the one administrating the benefits rather than the specific company. Generally, all of this is generally, and everything is a little bit different. So certainly talk to your union representatives, the union steward, to get a better understanding of what your benefits are, and also to determine the process to access the benefits if you need it down the road. And then one thing to keep in mind, and we're gonna spend some time talking about this next, but often union members may not have paid into the Social Security retirement program, or had FICA taxes taken out of their checks. Some of that has been changing for unions more recently. So they may actually be paying both into the union and into Social Security, but that's something to look at and get a better understanding about. Because if you have not been paying into the FICA taxes or the Social Security program, you may not be eligible for Social Security disability. And all of your disability benefits then would be administered through the union. And some examples of this I've included down here, but just something to keep in mind because it can just be another consideration. So, yeah, I think that it can get complicated, I guess, is the moral of the story. Open enrollment season can be a really helpful time to get information about your benefits and about both what's involved and what you're eligible for and the process to potentially access the benefits. So some people are maybe a little bit hesitant to go to their HR department and ask questions because they don't want to make anyone suspicious and wonder why is Sally asking so many questions about short-term leave? If you're asking during open enrollment periods, you're just gathering information about the benefits. And so it can be another useful strategy to get more information. So as I alluded to on the last slide, the next thing we're going to talk about are federal benefits. And the big federal benefit that we're going to talk about is Social Security disability. And so this is a program administered by the Social Security Administration. It is an employment-based insurance program that provides monthly income to individuals who have a disability that stops or limits their ability to work. And so you're going to get a copy of these slides in a follow-up email. So all of the links that I've included, you'll be able to follow to learn more. But this slide includes a link where you can learn more about the general Social Security disability program. And so Social Security, just more of a broad overview. Social Security benefits the amount of benefits you're eligible for will vary depending on both when your relevant work income was earned and also the amount that was earned. Social Security disability benefits convert to Social Security retirement benefits when the individual reaches full retirement age. And then if you're eligible for Social Security disability and you move through the process and are approved, then you become eligible for Medicare on the 25th month after your approval for disability benefits. And Social Security, just a distinction, Social Security disability is different from taking early retirement. So for some people, they think about taking early retirement as an option. And there are penalties if you take your Social Security retirement benefits early. You forfeit a percentage of what your full retirement benefit might have been. So the Social Security disability benefit, if you're moved through the process and are approved, you aren't penalized in a way that you would be if you took early retirement. So just something to keep in mind as well. If you're curious to better understand what your benefits might look like, if you were to kind of where you stand, how much would I get were I to apply for disability, you can create an account on the Social Security Administration website and actually see how much it would be. So this is a useful tool. And then there's a lot more that you can navigate through on their website as well, kind of what you've paid into the program over the course of your lifetime. So then eligibility. And this is where it can get a little bit murky or complicated. So again, lots of links, lots of follow-up resources. I know that this program can be really complicated, but I will say the Social Security Administration website generally does their best to kind of lay things out pretty clearly. So while the program can be overwhelming, their website is pretty approachable. So try not to be, I find it helpful, and I try not to be too intimidated by it. But the Social Security Disability Program is based on your work history. So that means that you need to have been paying into the program. And the FICA taxes that come out of that line item that you see on your paycheck, that is what's contributed to Social Security, your retirement. And then the other thing that's considered, it's called the recency rule. And I don't even know if I spelled recency right. You need to have earned 20 work credits in the last 10 years. And so 20 work credits is equivalent to having worked full-time for 5 out of the last 10 years. You earn a credit. A credit is equivalent to like a quarter, basically. So you need to have worked 20 quarters in the last 10 years. And there's a certain amount of money that you need to have earned in a quarter that changes annually. But I think roughly in 2024, it was close to $1,300 or $1,400. So not a significant amount of money, but you do have to have earned above that. Or I guess the other distinction is if you're self-employed, you need to be filing your self-employment taxes and making those individual contributions. And you can still earn quarters that way as well. If you're self-employed, talk to an accountant. They can help work through all of the process for better understanding what this might mean for you as an individual who is self-employed. And then you need to be determined to be disabled according to Social Security. And so you need to have a qualifying diagnosis. You need to be unable to work at a substantial gainful activity level, which is that you're able to earn a certain amount, work enough to earn a certain amount of money. Again, that also changes annually. All of these amounts and everything are included in this link below. You need to be unable to do the work that you previously did or adjust to other work based on your medical condition. So this is one of the ones that can sometimes be a sticking point for people. If you were an accountant, let's say, and needed to do a lot in spreadsheets and were using the computer and the mouse, and that's really gotten difficult to both physically maneuver, but also visually. If you are having some vision changes, the kind of just all of that going on may make it difficult. And so you may say, I'm not able to work anymore. Social Security might say that, yes, we understand you're not able to work as an accountant anymore, but are there other jobs that you might be able to do? And that's where the documentation in medical records and things like that also can speak to, yes, well, I'm having trouble in other areas as well. And it would be very difficult for me to work as a cashier, let's say, because standing is really difficult, or it'd be really difficult for me to work in construction. That would be unsafe. But it's sort of like you need to have the documentation to demonstrate that not only your symptoms impact the current level of work that you're doing, but also would impact your ability to do other jobs as well. And then your condition needs to be expected to last at least 1 year or result in death. So the big distinction for that is that this is not a short-term disability program. This is for people who have conditions that are longer term or will last more than a year. And then how to apply. You can apply 3 ways. You can apply online through the Social Security Administration website, creating an account and moving through that process. You can apply at your local field office, or you can apply by phone. Now, the caveat about applying by phone, the wait times to get a hold of someone at the Social Security office can get longer as the day goes on. And so they work on Eastern time. So the office opens at 7 a.m. or 8 a.m. Eastern. So call first thing in the morning and you'll be able to get through so fast in 5 minutes. I've definitely called at 7 a.m. Central Time when the office opens at 8 a.m. Eastern. And I've honestly been able to get a hold of someone within 5 minutes. But if I call later in the morning, you're looking at like 2 hours waiting on hold. So be strategic about when you call, but that's another option for you as well for the application process. And then be prepared. So there are going to be lots of questions and lots of information that you will need to provide when you move through the application process. And it can be helpful for you to start to gather some of that necessary information prior to beginning the application. If there's a few pieces that you're missing, don't let that hold you up. Start the application and work towards obtaining those last missing pieces. But I would say don't start the application cold turkey without having any of the relevant information. And you can find a full list of the information you need on their website, but a few big pieces of information you're going to need and can sometimes be a challenge or take a little bit of time to kind of rack your brain and gather are the list of your previous employers and the contact information, a list of the treating physicians or where you received care and their contact information, because they will need all of that as well. And then Social Security numbers for a spouse, former spouse, or minor age children, military discharge paperwork, birth certificates, death certificates, marriage licenses, divorce decrees. Some of those documents you may have readily on hand, but you may need all of those documents at one point or another. So just think about trying to get a few of the ducks in a row. A note about the medical records or the medical providers. This information will be used to request medical records to review your application. So that's why you want to try to have as complete information as you can and the most accurate information as you can when you move through this initial process. It will potentially reduce delays down the road, and it will also help build that paper trail, making sure that we are demonstrating kind of when symptoms started, when some of the symptoms may have been diagnosed, how treatment has been going, what you're noticing, have you been, when you participated in physical therapy, kind of having that trail will be really helpful for you. And some additional things to keep in mind. I mentioned some of this or one of these things earlier, but after submitting your initial application, you're going to receive additional paperwork to complete. And it often comes in the mail. It may also be available online now that I'm not as confident about, but you will get a longer application that's going to request more detailed information. So keep a list of things that you're having a harder time doing or are no longer able to do. And similar to some of that conversation that you might have around disability and going on disability with your employer, you also want to maybe think about that in terms for this application as well. So are there specific things? Is it harder for you to stand for a longer period, for a certain amount of time? Can you only stand for 10 or 15 minutes before either you're getting lightheaded or you're having balance issues? If the amount or the distance that you're walking has decreased, these are just examples. You know your situation the best, or you will know your situation the best as the time comes, and kind of keeping track of that so that when you sit down in front of that application and it asks you questions, if you're like me, my mind goes blank and I don't have the best examples that I might have had if I'd been kind of keeping notes for myself that would help me jog my memory at that time. Ask for input from those around you. Again, other perspectives can be really helpful and can be beneficial to inform the strength of your application and kind of the breadth of the things that you include. So they can be very valuable. And then consider what it looks like and feels like on a bad day. So we often go to the doctor's appointment. When I work in the clinic, we hear family members say, my loved one never looks like this at home, or I wish they could walk this well at home too. They're showing off for you. And we know, people want to look good and get a good report at the doctor's office, and that's really important. We also want to think about when we fill out this paperwork, we have our good days and we have our harder days. And I'm not encouraging you to lie. I want you to be honest, but I want some of that energy and time and the things you focus on to be not as much on your good days and thinking more about when is it harder? What does a bad day look like, or a bad afternoon look like? How are things more difficult for you? And that's part of the picture you want to paint. Some of the things you're still able to do, and with very limited accommodation or changes at all. And then there may be some other things that really have had to change over time. And so we want to represent those things well in this application, because we want you to be able to access the benefits that you're entitled to. You've paid into these benefits for your career, and so we want you to be able to access them. And then if there have been any work performance issues that you've been notified about, any performance improvement plans, any emails from your manager because you forgot to do something or overlooked something or it wasn't up to kind of the expectation, have those available as well. That also can help demonstrate that it is beginning to get more difficult for you to work, and here's how it's playing out in the workplace. Again, another helpful resource. Another thing to consider, I'm sorry, this one looked just like the last page, so I wanted to make sure I wasn't just talking about the same thing over and over again, is we often get questions about, do you need an attorney? No, you do not need an attorney to complete an application for Social Security disability. We've had lots of people successfully begin and move through the process to obtain benefits completely on their own. Others feel more comfortable and would like to have that reassurance or that person who knows what they're doing assist them. Or you might do a little bit of both, where you start the application on your own, and then if you run into issues, whether it's a delay or a denial, then people may opt to utilize the services of a disability attorney. And so I've included a resource. There are several associations that of representatives who help people apply for benefits, so you can explore that. Word of mouth is really valuable if there's other people in your community or your support group, through the physician's office. If they know someone, an attorney that other people have used, it can be really helpful too. Appeal, appeal, appeal. So we want to protect that. If your application gets denied, you'll get a letter in the mail letting you know of that denial. And there's an appeal process that's time limited. It's generally 30 to 60 days. And there's a process to appeal. You get 3 appeals on an application. And it could be a denial for something little, like they didn't receive your medical records from an institution in time. And if any institutions are like the institution I work for, their medical records department is buried in requests. And so sometimes we call and say, hi, we need these records sent over. And then the Social Security office will receive them. So we want to appeal that decision so it keeps that application alive. And there's some reasons why we want to do that. We want to protect that date of application, because down the road, certain things will be kind of based on that date of application. And if you started an application and waited 6 months and got denied, instead of starting a brand new application and losing the 6 months that you waited for the last one, appeal, and we're still holding on to that date of application that was 6 months ago. And we're just kind of continuing to move forward. And I'll talk about why that's important later. But if you take nothing away from this presentation, it's appeal. Just appeal your Social Security disability application as many times as you can, the 3 times. And if it's getting a little dicey and you're feeling like I would like some support, then maybe you consider having an attorney step in at some point in that appeals process to help you continue to move forward. So a big benefit, or something that I want to make sure that people are aware of, is the compassionate allowance. And so Compassionate Allowance is a program specifically designed for more rare or unique conditions that are determined to qualify as reaching disability determination standards through the Social Security Disability Department. It's sort of something on their end, the determination process. And so MSA, PSP, and CBS, CBD are all included on the Compassionate Allowance list. And so this is an important thing to keep in mind. It means that your application will be expedited through the approval process. It's flagged and kind of moves through jumps ahead in the line, essentially. But you do need to make sure that the disability or the diagnosis that you put on your application is consistent with what's in the Compassionate Allowance list. So I've included the list of diagnoses. I will say, just as you look at that list, it can be a little bit, it can be a little intimidating to read about the diagnoses on the Social Security website. So just be mindful of that the language and the information used in this website may not be as patient-friendly as you might see in other forums. So more just want you to know about it and utilize it, but may not be the best place for you to get all of the learn more about these specific conditions. And then what happens once you are approved for benefits? You do a happy dance when you get the letter in the mail, because congratulations, you've been approved and you've made it through all the hurdles and gotten to this point. And so you're going to receive a letter in the mail, and it's going to let you know both when your benefits will start and what your monthly benefit amount will be, and the date that you'll receive the payment each month. Benefits, you're eligible for payment after 5 months after the determination of disability, or 5 months from the date of application. So if you waited to be approved for 9 months, let's say, you would get a lump sum payment for 4 months of a catch-up payment when you start receiving payment. So that's, again, why it's really important to protect that date of application. Another consideration is that you become eligible for Medicare on the 25th month after your date of application. And so if you waited for approval for your disability benefits for 9 months, then you have to wait a year and a half, but you don't have to wait that full 2 years. And so unfortunately, the only conditions that receive automatic approval for Medicare are end-stage renal disease or ALS. So you do have to wait that 2 years for the Medicare eligibility. But if you already waited 9 months, we want to hold on to that and not lose that 9 months that you would have waited. So that, again, protecting that date of application is really important. And what if you don't qualify for Social Security disability? There may be several reasons why someone might not qualify. There's another program through Social Security called the Supplemental Security Insurance Program, or SSI. And so you may be eligible for benefits under SSI if you have a disability, are over the age of 65, don't have the work history or don't meet the work history requirements, and there's no waiting period. So you could, once your application is processed, you may be eligible for benefits right away. This program, people tend to have lower income or no income and very limited assets. So this program gives people some income. It's a lower amount, but it's certainly a valuable resource for people and worth exploring. And so you can learn more here on the Social Security website. And so then we're going to transition a little bit, and we'll move into talking a little bit more about mobility and some mobility resources. And one of the big ones are durable medical equipment. And durable medical equipment are pieces of equipment that are covered or determined to help people continue to maintain their independence and move through the world. And so there are 5 pieces of equipment that tend to be covered by insurance, and you can receive a new piece of equipment every 5 years, though there's kind of an escalating process. So if you receive a cane first and then get a walker next, let's say, and then a wheelchair after that, you can do that in 5 years. But then after the 5-year mark, if you already have a wheelchair, it may be hard to justify that you need a cane again. So just sort of keeping that in mind. But you must meet their eligibility requirements. There's a lot more flexibility and more information about the pieces of equipment or the circumstances when things may be covered on the Medicare website. So, for example, if you were to fall and break your ankle, Medicare would also cover crutches, but that's not typically something that this patient population is utilizing. So I didn't include that here, but these pieces of equipment are generally covered by Medicare and commercial insurance as well. So a useful thing to have in mind. And then we know that mobility changes over time and that not all durable medical equipment is created equal. For some people with movement disorders, those heavier walkers, the U-step walker, might be a better option for them, especially if they have a tendency to fall backwards. So you might think about wanting to get that type of walker versus a kind of standard rollator walker. And so thinking about how we're utilizing our benefits. A transport wheelchair, that lighter weight wheelchair, that's easier for caregivers or family members to get in and out of the trunk for when we're out and about. Those probably cost around $150, kind of depending on where you are in the country. If you were to purchase one new, there's tons that you can find in lending closets and other used and things like that. But I would suggest thinking about that's a less expensive option. And for some of our patients, they might benefit from a more custom wheelchair. And you can obtain a custom wheelchair through a seating and positioning clinic. You can be evaluated to determine kind of, would you benefit from some additional adaptations to the wheelchair, based on your symptoms and what's going on. And the seating and positioning clinic can write the orders and work with the durable medical equipment company to make sure that the documentation is there so that can be covered. And a wheelchair like that could be upwards of a couple $1,000s. And so wanting to be strategic about how we're using our insurance dollars to make sure that you're getting the right type of equipment. And just one thing I'm going to throw in here, we are not going to spend a lot of time on it, but if you're thinking about potentially transitioning into long-term care and you're on Medicare, a note that the way that some of those benefits are covered shift when you move into long-term care. So the takeaway is, if you're considering a transition into long-term care, get any specialized equipment before you go into the facility. It's easy because Medicare won't generally cover it once you move into the facility. And then kind of as we're talking about mobility may also relate to kind of how we're moving through our environment. So to get a better idea of what modifications or adjustments you might benefit from around your home, you might consider a home safety evaluation. An occupational therapist can come into your home and take a look at your environment and make any recommendations, from things as simple to adding grab bars in the bathroom or removing rugs, rearranging furniture so you have a clearer pathway, to some more maybe wish list items that could be helpful for you too. And then considering home modification. And that's where the home safety eval can kind of inform, would it be beneficial to, make a change to the bathroom or widen a few doorways, and or add a ramp to the front of the house. And there can sometimes be some funds through the Department on Aging in your community. So certainly something to look into. It's not something covered by the insurance or by commercial health insurance. So just kind of putting that out there. And then I alluded to this earlier, lending closets are a phenomenal resource. They're all over in the community. Call your local senior center or your township building and ask where the lending closet is. People donate gently used equipment that they no longer need, and then others in the community can borrow it. And this is a way to try out equipment, see if a tub transfer bench will work in your tub at home. Do you have enough space? Or is that not or which kind will work before you purchase something and discover like, nope, I just don't have room for this. This is not going to work. So that can be a really helpful resource as well. And then quickly about transportation. So if you can obtain handicap parking placards that go with you, the individual with a disability, and can be used on any car, the kind of over the rear view mirror placard through your Department of Motor Vehicles. There's usually a form that needs to be signed by the physician to verify, yes, you meet the requirements, and then you'll be issued a parking placard. So those can be really helpful. It allows you to access handicap accessible parking spots. If you live in an urban area, there's also a mechanism to request a handicap parking spot designated on your street, like near or in front of your place of residence. And so you'll need to work with your community. In the city of Chicago, where I am, we'd work with our alderman's office to request those. So it depends a little bit on your municipality of who helps advocate for those handicap parking spots, but that is something that's available and certainly worth asking about. And again, ADA transportation, which is curb-to-curb transportation within your community, is another wonderful resource. Usually they're geographically bound, so you can't go all over for like a 2-hour road trip with them, but you can get to the grocery store or the barber or to the bank or to a faith community or something like that on curb-to-curb service. And depending, again, these can be very specific based on your community. Some are through the county, some are through your township, some are through your city. So again, reaching out to the senior center, or the your community center will be the best option to learn more about what's available in your community and the process to move through or apply. And then another option for kind of accessible transportation are also the wheelchair accessible taxi cabs. I'm sorry, I lost my train of thought. Wheelchair accessible taxi cabs. All the taxi cab companies do need to have a certain percentage of their taxi fleet that are accessible. You'll want to call the taxi cab company directly to request a taxi that's accessible. And then the ride shares, also Uber, Lyft, and GoGo Grandpa, have accessible transportation as well. And so resources to learn more. GoGo Grandparent, you actually can call a 1-800 number. You don't even have to have a smartphone, and they can arrange other things in addition to transportation. So like grocery delivery and things like that. So a nice resource. And then another type of transportation is non-emergency medical ambulance transportation. This is another way if you're having more mobility difficulty or more difficulty getting in and out of the house, this can be an option to get to important appointments or something like that. The caveat being it's not covered by Medicare or traditional employer-sponsored insurance, but may be covered by your state public health insurance for medically necessary appointments. And there needs to be some paperwork and advanced planning for this to utilize this, but certainly a resource to consider. And so the takeaway is that while we talked about a lot of big and complex programs that I really only gave you enough to be dangerous, but really there's a whole lot more about each of these programs, it can be really helpful to learn more about them and have a better sense or lay of the land ahead of time so that if or when you need them, it can feel a little less overwhelming because you have a sense of what to expect. But it's also a balance of both understanding how much you can take in now and what you need and when you need that information, but also trying to help prepare a little bit so that it's not completely new and unknown if or when the time may come. So with that, I'll send it back to Courtney and questions that may have come in. And thank you so much for your attention.
Sarah, that was fantastic. Thank you so much for teaching us all those things. So we received 2 great questions. And then I do have a few questions from our registration that I'll throw at you as well. So the first one that we received in the chat is, how does receiving SSDI affect long-term care payments?
Yeah, this is a great one. As I was creating this presentation, I wasn't sure how.
It's hard to know what to cut. It's only an hour. We only give you an hour. I get it.
So long-term care or long-term disability through an employer, and I'm going to talk about that, and then maybe I misunderstood the question. But if you're an employee that goes out on long-term disability, your long-term disability company often will help you apply for Social Security disability. And they have an incentive to do that to help you get approved, because if your employer's plan says we'll pay you up to 65% of your previous salary, and then you get approved for Social Security disability, and maybe that makes up 30% of that 65%, then the long-term plan cuts down the payment so that it equals up to 65% in total between those 2 programs. So those 2 programs work together like that. If you have like a private long-term care disability plan that's not through your employer, I don't know that necessarily is impacted by Social Security disability, but when I say that, I'm thinking more about like long-term care insurance. So I might be missing part of that question, but.
Yeah. Kim, feel free to let us know if we need some clarity. We're happy to provide some, but I think that was a good answer. Okay. The second question is, what office should they contact about a designated accessible van parking spot? If they don't know who does this, and if there are simple grants or loans for organizations to help purchase a used wheelchair van.
So to learn about where you might go to get an accessible parking spot,
yes,
it's going to vary a little bit in your community. So I would probably start with like your senior center, or if you have the time and are able to, going into the DMV office, they may be able to tell you, but some of them aren't necessarily granted by the state. They're granted by your city or municipality. So calling your city and asking, or going to the senior center is more likely to be more fruitful. The DMV doesn't necessarily designate kind of parking spots in your community. So in Chicago, the example I said, like, we have the city government, we have the county government, we have the state government. There's probably more in there, but then I also have a smaller area government that is my alderman, and my alderman is the one that I would actually go to request the parking spot for where I live in the city. So as an example, there's like 4 or 5 layers of government in there, and I go to the most local level.
That's great advice.
As far as
okay, you got it. Great.
Grants for obtaining accessible transportation, I don't know of any off of the top of my head. Now, that doesn't mean that they don't exist. I honestly probably think they do exist, but my best recommendation would be, again, a few. I have a master's degree in social work, but I really think that I'm a professional Googler. So you can Google like grants to help offset the cost of accessible transportation or something like that. Also, asking at your loved one's doctor's office, like the neurologist. Often neurology offices have social workers or have access to a social worker. They are going to be better aware of what's available in your community, the senior center, things like that, or what might also be called your area agency on aging. There's area agencies on aging all across the country, And so if you, I don't know that I put this in there, but the Elder Care Locator is a resource, a federal resource that helps you identify kind of where your area agency on aging is in your community. And I might even reach out to them and they may know of resources available to you as well.
Great. Those are awesome recommendations. We got another question in the chat, and it was someone's mother who was just recently diagnosed. She's 67, so she gets Social Security, but her father is only 59. Are there any benefits he can receive for being her primary caregiver?
Through Social Security, I don't believe that he would necessarily be able to qualify for any benefits to be her primary caregiver.
Yeah, maybe any extraneous resources that you've heard of as payment of being a full-time caregiver.
So depending on which state you're in and kind of the way that the programs are set up, the Department on Aging often has a homemaker program, or in Illinois, it's called the Community Care Program. It's called something a little bit different, but it's for in-home caregivers. And so if your mom qualifies for that program, she would need to be evaluated by the agency that kind of contracts with the state. They would come in, evaluate her for services. And if she's eligible, then you can designate a preferred worker. And so it's possible to designate your father to be her preferred worker. The caveat being, and I don't know if this is state specific, but in Illinois, preferred workers are not allowed to be the power of attorney. Mm-hmm. So if your father is the power of attorney for your mother, that might limit his ability to be the preferred worker in your state. But again, some of these programs are so state specific that might not even be a rule in your state. So don't let that deter you from kind of learning more about the program. But there is a way that he could get paid for some of his time. It certainly won't offset all of the time that I imagine he's providing support to your mom. But it's something.
Great. Okay, we have. Do you have another minute to go?
I do. I do.
Thanks. Really appreciate it. I think we have some great ones that people would benefit from. Okay, so this one is going to employment. Do you have recommendations for someone who feels that their performance at work is slipping and it's being noticed the diagnosis to an employer yet?
I'm sorry, say the last part about it again.
They have not disclosed their diagnosis. Maybe it's not fully confirmed yet, but they have not disclosed the diagnosis, but they are seeing they're unable to perform the same tasks and that their boss is noticing. Do you have any recommendations for them?
Yeah, a few. You could still potentially request reasonable accommodations. And you can request, you can explore that job accommodation network based on the specific task. So if there's certain tasks you're struggling with, look under those task-specific things. If you don't have a formal diagnosis yet, but they're kind of working you up for something, you still may be able to access benefits or access those accommodations because they're symptoms and they're documenting that they're symptoms and they're trying to rule things out. You also might consider whether or not you've disclosed your disability or your diagnosis. You might consider going on a short-term leave while you're kind of being worked up to determine if you're not fully diagnosed yet. You could go take a leave while things are being kind of fully worked up and potentially do some intensive physical and occupational therapy during that time too, and see how does that help. Do you feel like you could try going back to work? But you can still go on short-term disability and potentially move to long-term disability if you're having trouble performing the job tasks. But I might think about, are there some things you could try in the meantime to tide you over a little bit? But if you're concerned about getting fired, I would consider a leave of absence first to give yourself some more time to get a little more information about what might be going on.
Makes sense. Okay, and then I think I have 3 what I think are pretty quick questions. I could be wrong, and I'm willing to be wrong.
You haven't met me.
Great, as long as you have the time. The first one is someone who is collecting Social Security also eligible for SSI, saying that they meet the criteria?
if someone is receiving Social Security retirement insurance,
Yes.
you generally can get one or the other. So or one of the three. If you're getting retirement, you are not eligible for disability or SSI. And if you're getting SSI, it means you don't meet the eligibility for the other two.
Okay. See, that was pretty quick. That's good. The next one is, if somebody receives a denial from an insurance company about a durable equipment, can they appeal that? People have been denied before for wheelchairs or other pieces of equipment.
Yes. Yeah. Appeal.
Appeal.
Or go back to your provider who ordered the equipment and say, can you provide more? Like, we need more supporting documentation. Call the insurance company and say, okay, my request was denied. Can you tell me why? And they may say, well, we don't have enough supporting documentation to justify the headrest that your doctor ordered. Okay. So then go back and ask the doctor for more documentation.
Awesome. Okay. And the last question I have is, oh no, I've lost it. Oh yes. So for folks who have been waiting, you had mentioned 8 or more months. We have somebody who wrote in that has been waiting almost 10 months. Do you have any tips, tricks, just words of validation for those who are waiting that long to receive the benefits?
Yeah, I'm sorry. It's not uncommon. It's not uncommon to have to wait a while in the process. If you're noticing that you're not getting updates, at that point, you probably would have received a letter notifying you that you've been assigned like disability determination individual who's kind of your point of contact. You can also try to reach out to them directly to get an update. It can be a little bit hit or miss reaching them because I imagine them just being buried in stacks of paperwork behind their desk. Honestly, it's probably a computer now, but that's my vision. So but you can try to ask for an update, and just, you can frame it as like, I just want to make sure you have received everything that you need. If there's anything else that I need to help provide for you in order to process my application or my claim. But if you're still waiting, it means that we haven't been denied. We're still in the process. So there's still the potential that we're going to move towards benefits being awarded. And if it gets to 11 or 12 and you get a denial, appeal, and then maybe think about if you want to have help with that representation or that appeal. So.
Got it. Okay, and one more question popped up in the chat. I just wanted to ask that quickly. Is somebody who receives VA disability, can he also receive Social Security disability? Or again, is it the kind of one or the other?
No, this is a great question, and I didn't have enough time for everything. But if you have paid into both programs, so like if you are a veteran who also worked in another job and were paying FICA taxes, meet the criteria, you can apply for disability benefits through Social Security. So it's possible that you could get both. It's possible that you could be a union member who's receiving and paid your union dues and receiving union disability, but at the same time you were in the union, you were also working a second job and paying into Social Security disability. It's possible that you may be able to also apply for disability benefits as well. Sometimes you do have to disclose if you receive other benefits. So it may adjust the amount that you're receiving from one of the first organization. So whether it might affect your VA benefits or your pension benefits if you also are awarded disability. So something to consider. But yes, if you've been paying into it, you're certainly entitled to try to apply for benefits.
Okay, I'll stop asking questions now. I echo everyone who is watching this live and in the future that this was insurmountably helpful. Breaks down a lot of the very intimidating processes. So thank you so much, Sarah. We really appreciate you joining us today. And in just a few closing words, as we said before, the session it has been recorded and will be emailed out to folks who have registered. It will also live on our YouTube page for future viewing and sharing. Once again, please email us if you didn't have your question answered or you think of something later on. info@curepsp.org is where you can reach us. No question too small, so please feel free to reach out. And come in January, we'll announce some great events for the year, especially our Ask the Expert series continuation. But I did just want to quickly flag that we will be hosting an in-person community weekend in Detroit, Michigan, May 1 through 3. And that's going to include our Run for Hope 5K and also a 1K option. Please feel free to join us. Wanted to flag that for you for registration to open in the next week or so. Thank you, everyone, for joining us today. I'm looking forward to reconnecting with you all after the new year, and I hope you have an incredibly restful holiday season. You've definitely earned it. Bye, everyone.